Deputy Pringle and Deputy Connolly. Thank you. So I'm delighted to have the brief opportunity to speak on this health motion, which ironically, of course, has been brought to us by the Fianna Fáil party, which played a large role in the almost annihilation of many aspects of our health system since 2008. And when one looks at the basic information on the motion, that over 660,000 people are on a hospital waiting list around the country, more than 100,000 outpatients waiting for more than a year for an appointment, over 46,000 people waiting for more than 18 months, according to figures from April 2017. Most citizens will conclude, of course, that the health service that Minister Harris runs is just not fit for purpose. And of course, it's extraordinary that the present leader of Fianna Fáil is a former health minister, and you'll remember the days when he was under great pressure in this House, Ken Corla, and facing votes of no confidence. And it's also amazing that a putative leader now of Fine Gael this week passed through that department without hardly making a mark, or I can't remember one single important announcement, and apparently, well, according to former Deputy Nora Owen, fled out of the department before he was asked to take any major decision. On 6 February last, we were shocked, I think appalled and disgusted by the RTE Primetime Investigates programme, Living on the List, which showed the reality of a life of pain for tens of thousands of people awaiting procedures in our hospitals. The programme also highlighted the disingenuous way in which waiting lists are being administered and reported through the National Treatment Purchase Fund. The NTPF excluded data from the pre-admit list in its monthly reports, a figure that stood then at 22,927 patients nationwide waiting up to 18 months for surgical procedures. There were then almost 59,000 patients on the pre-planned list, and included those who need treatment such as hip replacements and scoliosis surgeries for children, for example. And my weekly information clinics and I'd say, like all other deputies, I'm often contacted by people at their wits' end, on waiting on these appalling lists. Particularly frustrating recently, Minister, has been the number of older constituents, with cataracts who are waiting for more than a year and whose eyesight is deteriorating rapidly, and also all of those waiting on hip replacements. Since June 2016, I'm awaiting a reply from you, Minister, about the status of the new A&E at Beaumont, and the outgoing austerity government, of course, highlighted the new A&E project but did nothing to bring it to fruition, and the current government seems to be also dragging its feet on it. I'm also awaiting replies from you, Minister, on the National Treatment Purchase Fund pre-admit and pre-planned procedure lists and on the number of patients awaiting knee and hip operations at Beaumont. I've written to your office directly requesting these PQ replies, so perhaps that's something you could expedite. So I just want to welcome finally the report today on the Future Healthcare Committee led by Deputy Roisin Shortall, which I think does offer great hope for the future. I do welcome the fact that the Minister seems to have had a broad welcome for it, and hopefully at the Budget Committee we'll discuss it further. Thanks, Cam.
Deputy Pringle.